Welcome to the Being Rare podcast, where we talk about navigating life with rare disease. I am Sarita Edwards, wife, mom, award-winning advocate, nonprofit founder and CEO, and your host. Sit back, relax, and enjoy the show. We are still in the month of March, celebrating Trisomy awareness, and I am really excited about today's episode. But before I jump in, I do want to give a little highlight, a little backstory. Several months ago, there was a lot of misinformation circulating in the news media about Trisomy 18 diagnoses and its impact on unborn babies and pregnant moms. And I think for me specifically, my issue had more to do with the statements that suggest trisomy 18 is non-viable and that pregnant moms could experience extreme health concerns, including death, from carrying a trisomy 18 baby to term. Now, let's be clear that I am not discounting the reality that complications may come from carrying a child with genetic abnormalities. However, there is a risk of complication with any pregnancy. In fact, according to the CDC, the leading underlying cause of pregnancy-related death include mental health conditions, excessive bleeding, cardiac and coronary conditions, infection, thrombotic embolism or a type of blood clot, cardiomyopathy, a disease of the heart muscle, and hypertensive disorder of pregnancy, which is related to high blood pressure. And so when we look at maternal mortality numbers, it's safe to assume, to acknowledge, and to realize that, especially for Black and Brown communities, mothers are dying because of all of the potential conditions that I just list and more. And carrying a child with trisomy 18 or another genetic condition, again, may pose some risk. I don't know, but I do know that pregnancy-related death and complications come from carrying any child. And so I'm excited for today's conversation. I'm speaking with Kira Dineen, who is a prenatal genetic counselor and genetics podcaster. We are not talking specifically about the misinformation, but it is stuff like that makes today's conversation important. Kira and I had an opportunity to connect many, many weeks ago. I was actually on her show. She's a podcaster for at DNA Today. I had the opportunity to be on her show. And I thought it just made sense for she and I to kick off this conversation about, what information are genetic counselors giving to families who receive a trisomy 18 diagnosis. And I understand that it's going to vary from, family to family, counselor to counselor, OB to OB, healthcare facility to healthcare facility. I know that the conversation is going to be it's going to be varying perspectives. And so again, she and we are not talking about the misinformation per se. We are just talking about what information does she herself give to families when it comes to this. And then we're talking about her podcast too. I actually had the opportunity to be on her podcast. And I'll put the link to that in the show notes for this. But so I'm really excited about today's conversation. We actually recorded the episode a couple of weeks ago, so you may hear some stuff that's past, but stay tuned for my conversation with Kira coming up next. Edwards syndrome, commonly known as trisomy 18, is a rare chromosome abnormality. The Iwi Foundation is a 501c3 healthcare advocacy organization created to support families living with Edwards syndrome. The Iwi Foundation offers health literacy and community resources, comfort care, and financial support. Information at theewefoundation.org. Hey guys, welcome to another episode of the Being Rare podcast. I think since the last time we talked, the honey and I, we celebrated our 20th wedding anniversary. We celebrated Valentine's Day. We celebrated Rare Disease Week on Capitol Hill. So you can check all that stuff out on our website and our YouTube channel. For those of you who don't know, our fifth child, Elijah, was diagnosed in utero with full trisomy 18, and that's what's brought me to the rare disease space. So let's get started with today's conversation. I am so excited for today's co-host. She is a fellow podcaster, the DNA Today podcast. She's also a prenatal genetic counselor. I would like to welcome to the Being Rare stage, Kira from DNA Today. Kira, welcome to Being Rare.
Thank you for having me on, Sarita, and congrats. You've had a busy few weeks. It's Rare Disease Month, 20th anniversary, Valentine's Day. Wow.
I'm telling you, right? It's just one thing back to back. I think I had 2 weeks off in the month of February, and it was just, it was, it's the good kind of busy though, right? It's just,
Oh, those are all like celebrations and right. That is fantastic. Yeah.
Yes. So excited. So guys, you have to know that Kira and I connected because a colleague shared her podcast with me, and she had an episode, I think it was episode 228. Kira, correct me if that's not right.
Oh, you got it. Good memory.
Episode 228, she was talking to someone about trisomy 18. And so that's what drew me to her podcast. And I knew I needed to have her on. We're going to talk about a lot of things, hopefully, but let's just jump right in. Many of our listeners probably have no idea what genetic counselors do. I know to some degree, I started out confusing genetic counselors with geneticists. And I think it's important to just kind of start at the foundation. What does your day look like? What exactly is a genetic counselor, and how can a genetic counselor be beneficial to folks in the rare disease space?
Yeah, I think that's a great question. So genetic counselors are healthcare providers that help patients understand the genetics of their family and, for me, their pregnancy. So, it would have been appropriate at the time when you were pregnant with Elijah for us to meet if we were in the same space. So in the alternative universe, maybe I was your genetic counselor.
Right.
And, so we really talk through, okay, what are the genetics of the pregnancy? Is there genetic testing that would fit for you? And looking at seeing what conditions may come up. Sometimes there's indications to do genetic testing based on ultrasound findings. So some people like yourself during pregnancy may find that there's something different on ultrasound that make us suspicious that there could be a genetic condition there. So that may lead to conversations about doing genetic testing and if that's a fit for them. They may have done some blood tests that come up that there's a high chance for a condition. And, that family says, well, we don't want to know chance levels. We want to know a diagnosis, a yes or no answer on that condition. So we really are able to walk through that decision-making process and educate on those options, but also educate on the condition that might come up. So, in your case and a lot of other people that are listening, what is trisomy 18? What are the findings on ultrasound that kind of make us think that there could be trisomy 18? What are the chances for different, events to happen, like a miscarriage, a stillbirth? What does life look like if you have a baby and they're discharged from the hospital? So really just being able to be sort of a guidance counselor and educating, but the other aspect is also just processing a lot of the emotions, right? Half my title is counselor. So being able to say, how have you been processing this information? What does your support system look like? And being able to just go through those emotions and those thought processes to say, like, where are we at? Like, how can I best help you at the point that you're in your life right now?
Wow. I just got to say, in the alternate universe, you would have been a great genetic counselor. And in this universe, right? In this universe, you would have been an amazing genetic counselor. Because I got to be honest and just share with you guys. We did not know that Elijah's condition was genetic until he was many, many months old. Wow. And we saw genetics for the first time when Elijah was 10 months old. 10 months old. And it's not because there was a waiting list. We just did not know that we needed to see genetics.
You just didn't get that referral. Yeah.
We did not get the referral at all. And so that leads me to my next question. In terms of trisomy 18 specifically, what kind of information are you guys sharing with families? We know the facts that come with trisomy 18, but we also know the reality that a lot of families are being told one narrative. And I'm just curious, what type of information is being shared about the trisomy 18 diagnosis and what families can expect?
Yeah. So, unfortunately, a lot of healthcare providers will use the term lethal when talking about trisomy 18. And I really disagree with that narrative. I think we need to replace that narrative with life limiting. I think that, to me, and please tell me if that resonates better with you, because obviously, we learn so much from people that are actually caregivers and parents of people with, trisomy 18. But I think when it comes to that, life limiting is, I think, a more appropriate term, because it is not necessarily a death sentence like a lot of providers will present this information. It's a very serious conversation in terms of, what could come up. There can be ultrasound findings, as we talked about, that could lead to medical problems, could lead to surgeries that are recommended, can lead to other differences and challenges. But I think it's important to be providing a fuller picture instead of a very narrow approach of, well, what's the most likely situation? That's important to talk about. I don't think we should be gatekeeping information from patients, but at the same time, we need to talk about what are kind of all of the different situations that could be happening. So I think when it comes to ultrasound findings is sometimes one of the first pieces of information that we get. Certainly that was your case. We learned a little bit more about your story on an episode of DNA Today. So, thank you again for coming on the show there. Right. We're doing our interview swap here. So,
right.
Yeah. So, and a lot of people, nowadays, because you were pregnant with Elijah about 8 years ago, because he's going to be 7 soon. And so nowadays, a lot of people are doing genetic screening at, sometime between 9 and 13 weeks is often when people will have that blood draw. And so a lot of people are finding out that there's a high chance that their baby could have trisomy 18 at that point. And then we're looking for ultrasound findings after that, or doing diagnostic testing to say, we're going to confirm that this is actually a diagnosis and not a false alarm. But I think when it comes down to ultrasound findings, one of the first aspects on a 13-week ultrasound is if a baby has extra fluid behind their neck. So that's called the nuchal translucency. So that's often some of the first conversations I'm having with patients in terms of if there's extra fluid there. All babies have at least a little bit of fluid. That is completely normal. No baby has zero fluid at that point. So I think that's important to set the baseline there. But, increased fluid there. If we see a difference with the heart development, so if there is a hole in the heart, especially a VSD is more common for people with trisomy 18. There can also be differences in brain development that we might be able to see on ultrasound. Could be GI differences in terms of something called a diaphragmatic hernia. So our diaphragm kind of helps keep our lungs separate from our GI organs. If there's a hole there, our lungs may not have enough room to fully develop. So there's a lot of things that we're looking for on ultrasound that can be an indication that trisomy 18 could be present. So this might sound, if someone is listening to this because they're currently pregnant and maybe had some of those ultrasound findings, maybe that's helpful in just understanding that can often come up with trisomy 18, but in no way is this a diagnosis of those, if those symptoms come up, because these symptoms and different ultrasound findings can come up for other conditions. And sometimes it's just isolated. A baby can have a heart difference and not have a genetic condition that we know about. So it's really putting the puzzle together of what do we see? Can we put all these factors together, and what conditions do we think about in terms of it? And sometimes it is trisomy 18.
Yeah. And I think one of the things you just mentioned is really just helping families understand what they're dealing with and what those outcomes could mean for them and their families. And I think that that's so important, to not really hone in on this is what it is and this is what you can expect, right? Because at the end of the day, even if this is what it is, that doesn't mean that that's going to be an added burden for the family in terms of a responsibility burden, something that they don't want to deal with, right? Like I don't think we ever went into it expecting the journey to be easy after getting Elijah's diagnosis. We chose to go forward with it without giving a lot of consideration to the burden that was going to come with it. And so I love that you break it down and you talk about this is what this could mean, this is what this could look like. But at the end of the day, you help families with the decision-making process. And I think we just, some providers, they just don't do enough of that. And that's just an important piece to patient care to me.
It is. And I think sorry, go ahead.
No, go ahead.
Oh, okay. I was going to say that I think along with that, I think language is so important. It's something that I've really been trying to improve on. People will use terms like risk. And to me, risk comes with a negative connotation. And I think using terms like chance has a much more neutral approach to it. And you're not putting a label on that for the patients, because you could have, say someone like yourself, right? If your, sibling or something goes in and, is having a baby, or one of your children is having a baby, and trisomy 18 comes up and they get a call about this and saying, oh, I'm so sorry to inform you that, the blood screening came back high risk for trisomy 18. How does that make them feel about Elijah? That
Right.
I can imagine that puts on such a negative, like, well, what do you think about my brother, right? If it's, say, one of your kids in the future having a child, that ends up in a similar situation and experience. You don't want to insert yourself in and be showing, this is what I think about it. It doesn't matter what I think about it, right? It's all about, I'm providing this information and being neutral. And I think then you end up building such a better rapport with patients, and you get to hear, where are they coming from? What is their mindset? Is ending a pregnancy something on the table for them? It may not be, it may be, they may have no idea at that point. So I think it's meeting the patient where they're at, just trying to be as neutral as possible. I think that has really helped me in building relationships with patients and making them feel more comfortable, because I know when providers do that for me, I feel so much more comfortable. And I'm like, oh, they don't care where I'm coming from. I think that's just so important, especially with something so delicate like pregnancy, and especially in a country where there's a lot of turmoil in the past 2 years about abortions. And so I think that's something we need to be very respectful of.
I love that. I love that so much. And we can continue talking about this like the entire show, right?
Yes.
But
you and I can talk about anything for a long time, Sarita. Yeah.
Right. We totally can. Like I'm just a firm believer that when you make that right connection, it's endless conversation.
Yes.
Very much endless conversation. But I do want to transition real quick, because I have to talk about DNA Today. I was fortunate enough to be on a DNA Today episode. We actually talked about trisomy 18. Like I said at the beginning of the show, I reached out after a colleague shared an episode with me, and I knew that I needed to connect. DNA Today is a multi-award winning podcast and radio show that explores how genetics impacts our health. I want to just know, how did you find yourself in the podcaster space? I mean, you're a prenatal genetic counselor / podcaster. How did all of that come about?
Yeah, so I was a podcaster first. So I've been podcasting for like 12 years. I started in high school.
Wow.
And so about a year into podcasting, I started DNA Today. And for me, it was an experience to say, let me hold myself accountable. I knew I wanted to go into genetics as a career, but I wasn't sure exactly where. I was thinking about genetic counseling, but I wasn't sold on it quite yet. I felt like I needed to be more exposed to the field and see, is this really a fit for me? My mom is a social worker, so I very much grew up learning about counseling and just kind of hearing stories from her. Obviously, everything, HIPAA, she would just name everybody Jane Doe and talking about situations, and just being able to learn from her and how she approached things. And I really have always admired her career and just how rewarding it's been over the years for her. Wasn't quite nerdy enough for me. So I was like, well, if we can throw in some kind of science component, that's totally up my alley. Right. And she kind of came to me. She was like, Kira, I found your career. And I'm like, okay, Mom, what is it? She's like, genetic counseling. I'm like, what the heck is that? So, over the years and through the show, I was able to interview genetic counselors and see like, okay, is this something that's going to be a good setup for me? So starting the show was a very selfish decision. Honestly, it was like, how can I get genetic counselors to talk to me and other professionals in genetics? They're not going to talk to a high schooler. They're not going to take a meeting necessarily, but maybe they'll take an interview. So that's kind of how the show started, and it's grown with me. So now, as you said, I'm a prenatal genetic counselor. So I've been in the field a few years, and it's definitely just shifted. I think I'm hopefully a better interviewer as the years have gone on, and just being able to speak from my own education and training. And also just what I see with patients and people and their, experiences in their lives. So I think it's just been a really cool way to meet a lot of people like we would not have met if it hadn't been for the podcasting world. So I think it's just a cool way to talk to people that, we've only been talking for so long, and we've gotten into really valuable and intense in a good way conversations that you don't normally just get on a call with someone and just start talking about really deep information. So I kind of like the podcasting space from that angle.
Awesome. And are all the shows centered around genetics and genetic health and just patient lived experience? Is that generally the theme of every episode?
Yeah, definitely. So anything that's kind of human genetics is what we dive into. So oftentimes we have patient advocates like yourself on the show that is sharing, their story, their family story. We have fellow genetic counselors come on to talk about, their jobs. We have episodes that are talking about kind of more genetic news. Like, I don't know if you heard at the end of 2023, we have FDA approval of the first CRISPR-based drug for sickle cell, which is just amazing. I'm still blown away that, in my 20s in my career, I'm seeing this. I didn't think it would be until I was 50 or 60, honestly. Maybe I'm pessimistic when it comes to how fast, things can happen in the treatment space, but, it's just been remarkable. So CRISPR is something that I've just kind of followed since the beginning of the show. So it's been really cool over the last 11 years just to see how much I've developed. The first big CRISPR paper came out in 2012, and that's the year the show started. So it's just so cool to see how much has changed since the show has started 11 years ago, and just being able to dive into so many areas of genetics and, a lot of things related to genetic counseling. But honestly, anything human genetics, we dive into.
Awesome. That's so fun. I gotta say, I'm a nerd too. Okay, so listen, we could clearly keep talking, but I do want to be conscious of the time, and I don't know, we may have to do like a series or something. I don't know. Like, I will have to have Kira on. I'll have to bring her back and let you guys maybe dial in and ask some live questions or something. We'll think of something. She is phenomenal. I'm so glad that we're connected. She is officially a friend.
Yes. As you are, Sarita, right? Definitely. Yes. Love it.
Yes. Yeah. Thank you so much. Thank you so much for being on the show today. We're going to just wrap it up right here, because otherwise I'll start up another conversation. Guys, as always, thank you to Kira for being here. Check out DNA Today. If you haven't yet subscribed to the Being Rare podcast, I don't know what you're waiting for. Go ahead and hit that subscribe button on our YouTube channel. Go ahead and follow us wherever you stream your podcast, and make sure you got your notifications on so you'll know when we upload a new episode. Until the next one, guys, be rare. Peace. Thank you, Kira.
Bye, everybody. Thank you so much.
Thank you. Thank you for listening to today's episode. If you enjoyed today's conversation, please share it with others, post it on social media, or leave us a comment or review. Stay up to date on current conversations by subscribing to Being Rare wherever you listen to your podcast. Connect with us on social media at Sarita Edwards at the Being Rare podcast. Until the next episode, be rare.